On PM Express tonight, we are assessing our preparedness towards the coronavirus epidemic. Nobody's saying we are anticipating that it will be here, but you're better prepared. As they say, you're better safe than sorry. And we're going to be looking into what our health system, health authorities are doing to get us ready, and asking those who know if we are ready and what it would take for us to be there. What do we know so far? The death toll is currently 490 and infecting more than 24,000 people, mainly in the Chinese mainland. We have just one reported case of death outside China. Now the WHO last week declared this as a public health emergency. Tonight, they are asking for in excess of $600 million to deal with this particular outbreak in the next 3 months. So that tells you how important this is and how urgent it's become. Now, Ghana has not yet recorded any case in Gulf of Bay. We are expecting to hear that we have any case on our hands to deal with. However, the health ministry has already been telling us what they are doing to try and get us ready. Now, health minister says 2 more treatment centers have been added to the Ridge and Tema hospitals with more isolation centers and logistics to deal with the situation when it comes to the coronavirus. Also, government is putting aside 2.5 million cedis, again as a seed money to try and get us ready in case we record any case in Ghana. Additionally, we are importing 110,000 protective equipment, just as you see here, gloves, face masks, etc., for our frontline health professionals who will have to be dealing with this if indeed we get it. But there are concerns, in spite of everything we've heard from the health ministry about our preparedness and what we're doing. There are concerns tonight. We've heard concerns, for example, groups in health talking about concentration of our preparedness so far here in the capital. Also, we've heard MPs casting doubt on the plans that government says they put in place so far. Now, the Ghana Medical Association itself put out a statement recently in which they've advised government to, among other things, very importantly, strengthen surveillance system, because if you have a strong surveillance system, then you are dealing with the problem at the source. It's not going to come in before you have to now scramble trying to fix it. Now, also, they are also encouraging adherence to international and local surveillance guidelines and protocols as well in all health facilities, and also improved public education. The key thing in that whole chain there, we're talking about well-coordinated, rapid response system that should be put in place for this. So tonight, we've heard a lot about the coronavirus. We're going to look at our preparedness and see where we are, the testing, the ability to isolate, quarantine, as we've seen other countries do, because as you know, it's China. That's where the epicenter is, and Chinese go everywhere. Ghana is known to be one of those countries where, with a lot of Chinese nationals involved in many fields of endeavor. We're going to go into this with the experts after the break. On the show tonight, Dr. Dennis Lai is a national coordinator for Port Health at the Ghana Health Service. Joins us in the studio. Thank you very much for joining us. Also in the studio with me is Dr. Winfred Ba. He is a divisional secretary of the Ghana Medical Association, Greater Accra Division, and also joins us in the studio. We'll be joined on the phone by Professor William Ampofo. He is the head of virology department, Noguchi Memorial Institute for Medical Research, and they'll be tasked, if suspected cases are found, to test and see if indeed it's a coronavirus. We'll be speaking to Dr. Dubrow Binaca, who is the national chairman of the Coalition of NGOs in Health. Let me start with you, Dr. Lai. Are we ready?
Thank you very much. It's a process. So as and when situations change, we get to adapt measures aimed at, one, to prevent the cases from coming into the country, and two, if they do come into the country, to be able to detect them early to prevent spread, because they can spread easily. So it's an evolving situation.
So process, but where are we in that process as of tonight?
Well, so for example, if we take the airport, which is probably the primary focus because it's an outbreak that has happened in other countries. So we're looking at a situation where if it would arrive in this country, and we're hoping it doesn't, but if it should, the airport is one of the key entry points. Of course, there are land entry points into the country, but for the extent of the outbreak, where it's not on the African continent, we have it in Asia and some European countries and the Americas. So most likely will be air travel. So a lot of measures have been put in place at the airport. And I think yesterday we had some media, including colleagues from your outfit. We took them through the processes. So part of it is that we have everybody who's coming on an international flight to Ghana now to fill what we call a health declaration form. Now on this form, there are a set of questions we ask. And of course, we expect that people will give us genuine answers. But beyond that, we also have a process to check for their body temperature. And indeed, we've picked one person for whom we had to go test for coronavirus, which turned out to be negative.
So based on the temperature?
Yes, based on the temperature, and then we asked other questions. So he had traveled around Europe in a few places. So that meant that potentially he could have been in places where somebody could have had the infection. So even though it wasn't an extremely high index of suspicion, as we'll use in medical terms, we still felt the need to investigate. And indeed, we picked an influenza virus, a common cause of common cold. So the process of testing people's temperatures at the airport.
In this case, you picked influenza?
Yes, we did.
Okay. So he had a flu?
He had a flu. Okay. Yes, what would say common cold.
And not strangely, corona is in the same
It's
family.
similar. The symptoms are similar. In fact, the only thing that probably would distinguish now is when there's a history of travel to any of the affected countries. But otherwise, if we didn't have this outbreak, any patient coming to the hospital with such symptoms will probably just think it's a common cold.
Where did we test this?
Noguchi.
Okay.
Noguchi.
Does Noguchi have the test kits?
They do.
For coronavirus?
They do, and I'm sure Prof will confirm when you get
we'll
him.
Speak to him shortly just to get that clear up.
Yeah.
While you were testing, the process takes quite a while.
Yeah,
6
does.
hours,
Yeah.
that is if you get there quickly.
It does.
What happened to this individual?
So the individual was kept in isolation, in a room where every health worker who goes there must wear a certain set of clothing, what we call personal protective equipment. Now, this is to protect the health worker because this person, at the time we haven't confirmed, we don't know. It may or may not be. So once it's a suspect case, we treat as if the person has an infection. So what we saw during the Ebola time where people had all these clothes on, with goggles and face shield and all. So that is what was put on whilst we were managing the patient. Of course, the gentleman wasn't very happy, but he understood that we were doing this in the interest of public safety.
How long was he there for?
So he arrived, at least I was called around 2:30 a.m. about this gentleman with fever. And we got a sample taken early in the morning because we had to get, the equipment from one of our satellite facilities. And eventually it was sent to Noguchi. So later in the day, late afternoon, we got the confirmation.
Okay, so he was kept, how do you call it, in quarantine?
That's not quarantine. So quarantine, this is more of isolation because it's a suspected case. Quarantine has to do with people, assuming we're on a flight and somebody falls sick on the flight and the person is confirmed to have it. Everybody else on the flight would have to be kept somewhere and observed for the period what we call the incubation period, which is the time between when a person is exposed to an organism to when the person starts showing symptoms. And in this case, it's up to 14 days. So we want to observe them for 14 days to see whether they will develop the disease condition. So that's quarantine. So you quarantine people who have no sign of the disease, and you isolate people who may have sign of the disease or have the disease itself.
So were the medical officers who had to tend to this individual, did they have the protective gear that required for this purpose?
Yes, we did. And even those who took the samples as well put on the right equipment before they took the samples.
Okay. So your verdict is, at least at the airport, we are ready with the screening? It's adequate?
I think it's adequate. Adequate, I would say it is.
Okay.
Yes. And we're still strengthening the processes because, no system is foolproof. Let's not forget that there are countries with even more stringent measures and they've still reported cases. As I said, the key thing, our focus is on the fact that, look, you cannot stop somebody with a disease from coming to the country. Mm-hmm. But what happens when the person comes in is a critical thing. Because if we don't pick...
You can't stop the person from coming to the country.
Well, look, what's the criteria? We're going to stop everybody who's gone to China or stop everybody who's come.
That's one area I'll devote some time to look at quite exclusively because it's one of those controversial areas.
Yeah.
What's your reaction to his assessment of their preparedness, at least at the Kotoka International Airport?
Well, I think the public health people, they like you said, I think they are prepared at the airports. But for me, a clinician in the hospitals, I think that probably like he said, we are still in the process, so maybe they are getting there, but I don't think the preparedness in the hospitals is adequate now.
Why do you say that?
Yes, so just before I got to the studio, I work in Kolebu, and then I was just called by some of my junior colleagues. Hey, they said there's a suspected case, And so I called the public health director in Kolebu, who actually is there right now. So he briefed me. I said, I want to know because I know when I come here, I will be asked. Now, so we were told that we had these two nationals. One is a Chinese, one is an Argentinian. And they just walked into the emergency room in Kolebu. Apparently, and this is what I was told, about 30 minutes ago before I walked in here. So they walked in. They didn't even come for a referral letter. They walked in. Apparently, they said they went to another facility. I won't mention the name. And when the people suspect, one is a Chinese, one is an Argentinian. So when they saw them with these Malays and all the same things, they were like, go to Kolebu. They didn't even attend to them. They said, go to Kolebu. But we were told that the centers are Ridge and Tema General Hospital. But they asked them, go to Kolebu. So there's a problem with even communication. So they also came to Kolebu, they walked and they got into the emergency room. And then everybody is panicking. There was not even a call to say, oh, we have these two people we suspect, so can we? So then when they come, everybody, those who are supposed to attend to them are prepared. We'll try and maybe put them somewhere and go through all the tests. But yes, they got into the emergency room. And according to the public health director, one of them, so the Chinese left China in September of last year. So we'll say that it wasn't within the period. But the other person who had been living with him actually got into he also was in Shanghai, but that was in January, and came down. And they've been living together. Now they all developed some symptoms that fits the case definition, but it doesn't mean they have to. They have some malaise. They said only one had catarrh, one of them had a catarrh, but with all the muscle pains and everything. So they've taken samples and sent to Noguchi. But we are taking another sample in the morning tomorrow. So I'm just using this as a scenario. See, are we prepared? If you realize, Ghana Medical Association, we sent a press release on the 31st of January, and these were the things we were calling for. The first thing is the communication line. So the first health facility they went to, if they thought that, okay, let's say they thought we are not prepared or we are not a center, what should they have done? They just said, go to Kolebu. So there's a problem with communication in the first place. And then when they got to Kolebu, now everybody is, I'll see people sending me a lot of text messages. Hey, we hear there's a suspected case. There's panic. What is the reporting like?
And this is important because this is among health professionals.
Yes.
So if the health professionals are panicking.
Yes. And they have They have the right to, because everybody is scared. I mean, on the lighter note, today I read the post, and I hear in Juba, some Chinese diplomats got to the airport, and the health workers, they had to flee.
So I heard they called them and said they should meet at the tarmac. So when the Chinese diplomat disembarked, they sort of test the person and take the sample. But they say the time the plane arrived,
because they are also afraid for their life. In as much as our members, the health workers, are ready to help treat and prevent the disease, their health must and their lives must also be catered for. So for example, for now, for this case in Koli, the people have been isolated, samples have been taken, but what about the health staff, the people they came into contact with initially? So I think we are getting ready, like he said, but we are not ready yet.
Okay, a few things. Do they have protective gear?
Yes, so when I talked to the public health director, we have the protective equipment. So those who attended to them had the protective equipment.
Gear. Okay.
But the thing is that I don't know whether they took public transport or they took a car. They actually got in, walked through, and got there. Yeah. And in the emergency there, we have very sick patients whose immune systems are low. Yeah. And those are the kind of people who have severe disease.
They're going to go into that also, so the symptoms and why people die and all that, so that you can pay attention to. There's a lot you've touched on that I want to unpack, but I want to quickly bring in Prof, who is joining us, Professor William Ampofo. Hello, Prof. Hello, Professor Ampofo. Okay. Also joining me is Dr. Dubrow Binaca. Hello, Dr. Dubrow Binaca. We'll try and rectify that very quickly. But let's start with some of the key points that he's just touched on. Communication. What's a missing link there? Because so when this case came, the first hospital should have had a number to call and said, go to Ridge or go to Tema General Hospital. But clearly they were not aware.
I think he made the point that those were the facilities designated. So that information is out there.
But the health professionals don't know this.
I think, look, I don't think we should, but that's why I said it's an evolving process. Yeah. So some of these things you learn from them. The truth is that when this outbreak started gaining prominence, even before the WHO declared it a public health emergency of international concern, letters were sent to all regional directors and all CEOs of teaching hospitals to alert them of the situation, the case definition, and we had contact numbers. And in fact, my number was one of the numbers on that communication.
So and that is why you were called at the port?
I have been called several times. No, I'm even the media. So what I'm saying is that there definitely has been some break in communication along the continuum, because you send it to regional directors, they have to go to the districts, send it to CEOs of teaching hospitals, they have to go to the departments and communicate it to all the clinical staff. But that has happened. So look, it's a situation that we need to learn from flaws in the system and make them better. I can tell you this, the health declaration form we did initially, and it's supposed to, we had some information that was not on the initial form we did. We've been updating it. So such situations, when they come up, definitely. And look, as for health workers being afraid, let's face it, it's a disease condition that has no cure. People are dying. We can manage the symptoms.
Far more people survive. I mean, I'm trying to get people not to, you know,
I don't think that people...
Because let me share with I was reading from CDC.
Right.
This flu season in the US alone, CDC reports 10,000 deaths. Yeah. It pales in comparison.
Exactly.
To coronavirus. So don't panic.
Yeah, but that's, you know...
But it's true to say, it's a factor that it's not...
Yes.
There's no cure.
Let's face it, a lot of people talk about corona. Yeah. It's on everybody's lips today. Yeah. So yes, it brings out a lot of, you know, sentiments here and there. So we understand, and it's part of our strategy to communicate not just with the general public, but also with the clinical team involved. And part of the confidence is to have the equipment. Look, I was in this country when Ebola broke out first in West Africa. And one of the challenges, I was working in Konfanochi Teaching Hospital then, was the fact that people did not have personal protective equipment.
Yeah, which is key.
And I knew that my colleagues who are the emergency medicine, they kept telling us, Dennis, if there's a case, we'll run away. Okay, I don't think that is the case. And I'm happy he confirmed that the equipment are there. It's just like any other respiratory illness. Protective measures are no different from what you would do for somebody with, say, a flu or any other infectious disease that is spread by droplets. So we need to continuously sensitize our staff on some of these measures. And
I guess we need to continue doing these shows because clearly then people get to know what to do. I'll come back to you a bit more, but I want to go back to the phone lines. Is Professor William Ampofo on? Hello, Professor William Ampofo.
Hi, good evening.
Good evening. Thank you very much for joining us here on PM Express. Also with me is Dr. Dubrow Binaca.
Yes. Good evening.
Doc, thank you very much. Professor Ampofo, is Noguchi ready?
Yeah, we are as ready as we can be, considering the constrained circumstances.
Kindly please help us define as ready as you can be.
Well, we have the ability to test for the new coronavirus. We can also distinguish whether it's influenza virus or not. We're also making efforts to improve our testing capacity. It's a bit limited at the moment, but we'll do what we can. Over.
What would it take for you to get you to full ready?
Cash, plenty cash.
Plenty cash. Can you quantify now?
Well, I mean, to test 1,000 people, you need to put resources in place. You need to work, 6 shifts, round the clock if you want testing, because it takes 6 hours to test a batch of samples. It's not that easy. You have to have full PPE. So I've just given you in a nutshell. You have to have surge capacity. You have to have staff trained. You have to have the protocols working. So the usual stuff to do with the pandemic situation, outbreak situation.
Is it right for me to say that you haven't received enough resourcing to get you to where you would feel adequately prepared?
Yeah, this outbreak started, towards the end of December. We just had a crisis meeting at the presidency. Resources have been released, and we hope that they will get to us, because when you order supplies, reagents, it takes about, at least, even if you are doing courier and whatever, it takes some time, So we wish that things would move faster. Over.
What you just said there, as an ordinary citizen, layman, sound pretty concerning. I was going to use alarming, but I don't want to, because you say you've finished an emergency meeting, you are hoping that it will be released, so which means you have not even there yet where it hits your account so you can make the purchases, and then the delay.
Our request to the Ministry of Health and the Ghana Health Service, and they are processing it. So as the numbers increase, of course, they have to speed up the process by which the resources are provided. Over.
Please help us understand how urgently must we do this, knowing what you know elsewhere and happening across the globe.
It's easy to deal with 7, 10, 20 cases. When it gets to 50, 100, then you're looking at contact tracing. You're looking at hundreds of samples. And, of course, then you need, a lot more resources to process 20, 30 samples in 6 hours. Over.
Okay. So let me ask you from the virological point of view. There's a lot of focus on the Kotoka International Airport. Is that adequate? Hello, Prof.
Yes, go on. I can hear you. We're talking about Kotoka.
Yes, yeah. I want to get your expert view on what we are doing at the ports. At the ports, for example, particularly the Kotoka International Airport. From what you know, are we prepared from that end? And should we be focusing exclusively there?
Well, look, I just take you to influenza. Influenza is a respiratory-borne virus. And anytime you sit in an airplane and somebody's coughing, you have a high chance of getting flu. It's winter across the Atlantic Ocean. Anytime any flight comes in, there are a couple of respiratory viruses that will be coming in. So it is very difficult to prevent the entry of a respiratory pathogen. Let's not beat around the bush. I think, yes, there will be, screening. There will be thermal screening. They'll be looking out for people with fever, etc. But this virus is going around the world. It will get here sooner or later. We have improved our capacity to look out for viruses. We have a system in place, the Ghana Health Service, Sentinel Service for people showing up with influenza-like illness. This will enable us to pick up, pathogens such as influenza, such as coronavirus. We've done this before. Pilgrims coming back from the Hajj have been screened for the MERS coronavirus, so this is not new. We found coronaviruses in people who have respiratory illness. So this new one, yes, we need to get the capacity to be able to detect it and manage it.
Forgive me asking, you just said there that we might get it sooner or later. Are you saying that it's a matter of when and not if?
Exactly. I mean, in 2009, when we had the new H1N1 virus, influenza virus, that was a new strain. It took 3-4 months, but it came to Africa. And it's now the virus that is associated with influenza all year round. So the facts are clear. I mean, when we have a new respiratory virus, it does take some time, but it will go around and the immunity will build up. We'll find a vaccine. We will develop appropriate programs, but it will get here. Over.
And also, please give me your thoughts on this. In Hong Kong and other parts of the globe, and UK is doing same as well, they are having mandatory 14-day quarantine period for every flight of people originating from China. They don't want to do what America has done, where they completely ban flights from China, but they're doing even if you land and you come from China, mandatory 14-day. Should Ghana consider that?
Do you have the resources to quarantine 300 people coming off a flight in any facility in Ghana right now? You don't. So you have to understand that you have circumstances that do not allow you to apply such stringent measures. Besides, we're in a tropical situation. We're not in winter. I mean, what's the temperature here? It's 30, 34, 27, 28 degrees compared to freezing conditions across the Atlantic. So you have to take the local situation to perspective and have your preventive measures accordingly. Over.
Okay. And very finally, we've talked on communication. And of course, the Ghana Medical Association rep had talked about, give us a scenario of how they dealt with one suspected case. Pretty alarming. What sort of communications do we need now, at least even among health professionals, to get them ready, at least informed on what to do if you get a suspected case?
Risk communication is a very difficult subject. You are a media person, so you know how difficult it is. There are various social media sources out there, people putting all kinds of false stuff. So it's difficult for people to believe and understand the true situation. You have to constantly put out the information and get people to understand that this is a respiratory virus. It's not as dangerous for us here in the tropics as it is across the oceans where it is winter. So we need to keep, and letting people understand and not get them to panic and do other things. Over.
And you raised a very important point that this virus, just like flu, for us here, the risk of death is, well, what's your assessment? Is this something that we should be panicking about, or we should just take it easy?
I mean, look at the facts. Those who, according to the data that's come up from China, people who have been severely ill and those who have unfortunately died are those who had hypertension, diabetes, and those people usually succumb to respiratory illness in the winter. So, I mean, if you take over 22,000, 25,000 people who have been infected, and you have about 500 people who have died, in the winter, you have over 50,000 people who die from influenza each year. So you have to understand the perspective when you do the comparisons. Over.
So finally, your point is that there's no cause to panic about deaths, but we should focus on adequate resourcing institutions like yourself and hospitals to be ready.
No, I'm saying that just like how you have the elderly and people who have comorbidities, which we say you have hypertension, diabetes, etc., who get severe pneumonia and unfortunately have died, this is a dangerous condition. So we should note the fact, we should note the information that is coming out from areas and use the same information to manage our patients. That's what I'm saying.
I am grateful that you joined me. That is Professor William Ampof. I want to quickly bring in Dr. Dubrow Binaca, who joins us on Skype. Doc, what's your own assessment of where we are, what you've just heard there from Professor William Ampof, who is the head of virology at Noguchi? What's your own assessment of where we are in our readiness?
Yeah, thank you very much, and I appreciate all the contribution made by Prof and your other panel. And then, if we are talking about following the WHO guidelines that has been advised and directed that countries of interest should be able to adopt, then one must be talking about readiness. And as Prof mentioned, readiness, yes, initial alerts were circulated to all the regions, which I can give Ghana 5 out of 10. But when it comes to community engagement, I don't think that we have done very well in terms of community engagement. It is the community engagement that does all the necessary work. For example, government have not invited the stakeholders to sensitize them of their role they need to play. The Christian Council of Ghana, the Catholic Bishop Conference, the Muslim Association of Ghana, civil society groups in Ghana related to health, other related security bodies, all these have not been properly engaged. And therefore, when we have, God forbid, if we have a case, then it's easy for the case to infect from region to region.
And I must tell you, hearing the warning from Professor, hearing the warning from Professor Ampofo, he's a prof in this field. What he said is gospel. He says it is a matter of when and not if. From all that I've heard, it sounds to me that at least at the port there's something happening. But in terms of a comprehensive emergency plan, we are taking this a bit for granted.
No, we haven't done anything. We must be very fair and very fair to the Ministry of Health, Ghana Health Service, and largely the government of Ghana that we have to do something different. What we are doing, we are thinking that God is on our side and nothing will happen. But as health sector planners, we have to 100% plan for it. For example, you need to immediately activate all the sub-regional centers. I'm talking about Sampa, I'm talking about Nandom, I'm talking about Bumprugu Yoyo, and I'm talking about the Western region. Those areas must be properly activated. And we are talking about the, what do you call it, communication, risk, and community engagement. All over the world, where we are able to curtail some of these emergencies is because people are properly educated and engaged. And the prof is talking about what they can do at the laboratory, clinical aspect. But if the communities are properly engaged, you can have a well-managed infection, even if it happens. And we can investigate properly if you have the proper engagement of the community substructures. So it is very important that we roll out a comprehensive plan in this country to ensure that we have the everybody involved into the process.
Dr. Binaca, I want you to stay with me. I'm going to take a quick break. When I return, I will come to the Ghana Medical Association. Beyond the communications, they've issued a statement talking about other things, which Dr. Binaca had also touched on, a more comprehensive approach to dealing with this. And then we'll talk about the approach to dealing with arrivals from China at this critical time in our lives, really, with the spread of the coronavirus across the globe. Stay with us. You are live on PM Express on the JoyNews channel, and we are looking at our preparedness to deal with the coronavirus. I was going to say when it arrives, but I am saying if. I've heard from the professor, if you've been watching the show, who says it's a case of when and not if. And so I guess make of that what you will. But the point is, I have my guest in the studio is Dennis Laye. He is National Coordinator Port Health at the Ghana Health Service. We have Dr. Winfred Ba. He is the Ghana Medical Association's secretary in Greater Accra. Professor William Ampofo, who you heard earlier, gave us a pretty honest assessment of where we are as far as Noguchi and the preparedness is concerned. Is head of virology department at Noguchi Memorial Institute for Medical Research. And we still have on Skype Dr. Dubrow Binaca, National Chairman, Coalition of NGOs in Health. Doc, let me come to you. Your main concern at the start was communications, but the concern you put in the statement goes far beyond communication.
Yes, so we also called on our members, and for that matter, all frontline health workers, not just doctors, to avail themselves to, this is our country, it's our calling, we've been called to save lives, and that's what we'll do.
Easy for you to say?
Yes.
Which hospital do you work in?
I work in Kolebu.
Okay, so if you get a suspected case right now, what will happen?
I've not finished. But in order for us to do our work, we are calling on government to resource the frontline health workers.
What do you need?
The PPEs. We need the PPEs. We need a coordinated response. We need isolation centers. We need treatment centers where these people can be kept, so that we can contain this in case it comes into our country. And that we can also have our health workers safe. We want, for GMA, we want our members to work, and we are ready to work, but we want them to work in a safe environment so they can also be safe. They are also Ghanaians. Okay. So that is why, you see, I'm here. I know a lot is being done, but we still have to say it the way it is and say that we haven't gotten there yet. We need more PPEs. And you see, we think that more centers should be equipped than just Reach and Tema General. And the truth is, somebody comes, he could go, even private hospitals must also be part of the plan. Because somebody could just walk there first, as the first contact, before they are asked to go to Reach or Tema General. And so we think that the engagement must be a bit larger and get all the frontline health workers, both doctors, nurses, lab, and everybody involved. That's what we think.
Respond to the concerns about preparedness that we had earlier for me about even you may also have the same concern.
Yeah,
I mean, this is away from the port. We've dealt with the port, but this is general comprehensive preparedness.
Thank you. Again, I'll go back to, first of all, I think that the issue of communication, there's a lot of communication that has gone on. There are some sectors that may not have been engaged. And as I said, these are things that are ongoing. So yes, some religious bodies or some non-governmental organizations may not have been engaged. But it doesn't mean that the process of risk communication is not going on. It is going on. We would take these things in our stride. When the flaws in our processes, in our preparedness come up, we are not going to be defensive about it. We will take them on and make sure that we address the gaps that are found. So, for example, this issue about PPEs, I know the ministry has probably taken delivery of them, about 10,000 sets of personal protective equipment. This is going to be distributed based on risk assessment and certain parameters that I can't really, discuss. We don't need to go into details of that, but that is going to be done. And as I said, if, for example, the case that came to Kolebu, there was no PPE, I will be concerned. If a case appears in, say, Ridge Hospital or Tema General Hospital or any other hospital, and they don't have the requisite equipment, that would be a concern. So we need to address these. And I think when we were off air, you mentioned the fact that, look, we had some support for Ebola and those times. There were a lot of staff who were trained. I was personally involved in training about 300 staff in Konfano Teaching Hospital. So there is a certain skill set which can be refreshed.
Have you activated all that already? I mean, Dr. Dubrow Binaca says activate all the other centers now.
All regional directors have been instructed to ensure that we have existing public health emergency management committees. Every region,
have you activated
every
it?
district. the National Public Health Emergency Management Committee has been activated. The regions are to do same. And this instruction was sent by the minister himself.
Let's, two quick things before we wrap up. One about the port concern. Dr. Binaca, let me bring you in here. In other parts of the world, I asked Professor Ampo for his view on this. In Hong Kong and in the UK, they are doing mandatory quarantine, 14 days, if you are originating from China. What should Ghana do beyond the surveillance you're doing and the temperature, etc., etc.? Should we consider anything like that? There's extreme, what the United States has done, ban all flights coming in from China completely. And then there is the UK model and Hong Kong as well, mandatory quarantine. What's your own take on this?
Yeah, in Ghana, we are a bit different. We are very sociological in terms of managing our relation and health. And so all that we need to do is to strengthen the stakeholders, as I mentioned earlier, so that all the different sectors of the stakeholders are properly aware of the situation. And then the health workers or the emergency team at the various airport are properly equipped. I see on TV, and even myself when I landed at the airport, and I laugh, because the same people who are trying to screen, they are not properly protected. And so that is the starting point. And if we are able to do that and probably have some a bit of sophisticated machines at the airport, we could be able to properly minimize if there is any suspected case. And once it is done, and once we have activated our centers, there can be proper flow of transportation, risk management, and protocols to those centers for proper investigation to be carried out.
Okay.
There are a number of coordinated efforts apart from readiness. How can we ensure that the investigation are linked to laboratory, and that is also linked to prevention? We have not coordinated those efforts, and I'm still seeing that people are sitting at the regional centers and those Ebola centers that were created. They are still sitting there waiting for resources to come down to them before they can properly activate them. And that is not a very good sign. Okay. So I will not support what other countries have done, because they are more capacitated
than us.
Having a larger base.
Let me come to the studio.
We can manage our situation in a way that is much more planned and proactive.
Dr. Ba, at this point, if you're arriving from China and you know you're originating from China, is there any peculiar arrangement for those if you know the person's originating from China? I'll come to you, but I just want to clear that first.
They go through the screening like everybody else.
But why?
One of the... Again, Wuhan is on a lockdown. I know there are other places. Look, the examples we give, sometimes I think we need to contextualize issues. So, for example, the UK example, they've quarantined about 98 people or so. Nobody is telling us that there's 98 people who have traveled from China. In fact, there's a picture of Sri Lankan Airlines picking Sri Lankan students. The government went to pick students from Sri Lanka and from Wuhan, and they quarantined them. These are people who have been brought from the epicenter of the outbreak. So they are a risk to society. Those are the people who have been kept under quarantine. The United Kingdom, the flight connection between the UK and China is not 98 people.
Okay.
Even Ghana is more.
Okay.
So let's not create the impression that some countries are quarantining people coming from those places.
But, I mean, even if you're not quarantining people,
we give them so.
But if the method that the person is originating, shouldn't the person have a separate, more rigorous attention?
We do.
Because earlier you said it's...
Indeed, we ask them, it's the same procedure they go through, but we ask them more questions. And for example, we give them their contact numbers are supposed to be provided, and we also give them information on if they develop any symptoms.
What to do.
What to do.
Doc, what's your reaction to that question? What would you say to it? What should we do?
Well, I think, like he's saying, everybody goes through the same process. But if we know somebody is coming from China, then I think that we should probably do more.
Like,
what would you recommend that should be?
So, like he said, when they get to the airport, those who are even doing the screening are not in PPs.
that is not true. You know, I wanted to correct that as well.
Those doing the screening are protected?
I don't know when he went to the airport. I think you might have visuals from yesterday when we took the media there. They are in gowns. Okay. They are wearing goggles. They are wearing N95 respirators.
When you're walking in, all of them. Okay.
All our health staff.
So that's good.
So I think that is something, some error we need to correct.
Yeah, so then if that is the case, then I think for me, that is it. And like he said, they take their contact numbers, tell them where to go to. Like I said, because of our situation, we can't quarantine them because it's a lot of money, a lot of resources.
I mean, very quickly, let's do the education bit. What do you look out for? What do you do? What do you call?
Thank you very much. I'm happy to hear. Now, we know that it's happening in several countries. A lot of people are focusing on China. That is fine. So anybody who's traveled to China, it's not only Chinese. And we shouldn't keep making that mistake.
Okay.
There are countless Ghanaians who travel to and fro. You wouldn't know. You might see a Chinese, and because of that, you know, you take precautions. But how do you know that the person sitting next to you is not a businessman who's going to China? So the symptoms are fever. Your body temperature goes up. The person may cough, may have difficulty in breathing. There may be runny nose, and other symptoms.
Sorry, we have 30 seconds, so let's hit on that.
Let's make sure that when we have a cough, when we have a fever, we report to a health facility. Let's not cough without covering our mouths. Let's use a handkerchief or tissue. Worst case scenario, let's cough into our shoulder.
If you suspect you have a case,
go to the nearest health facility and tell them your symptoms. And if there's a history of travel, indicate that as well so that you'll be sent today.
Thank you very much. Thank you for joining us. Enjoy the rest of your evening.
Thank you.